Diving is not normally a physically demanding sport. There are challenges to it, to be sure, but for the most part we dive slowly and easily, exploring wrecks or reefs. There are times, though, when we need to be able to call upon our reserves and swim harder or react to a situation. Sea conditions may become more demanding than anticipated, and/or some emergency comes up, and that is the point where we have to be able to respond. The concept of fitness to dive comes in two parts. One is being generally fit enough for the rigors of diving. This includes responding to those unexpected situations, or carrying equipment to the dive site itself. The second part of fitness to dive means specific medical situations that may influence your ability to dive. There are very few medical conditions that are absolute contraindications to diving. Most are conditions that make us question a diver's ability to respond to those more demanding circumstances. Some of the specific contraindications make it more dangerous for the diver and for his buddy as well. For example, a person with a seizure disorder, controlled or not, should not dive. The possibility of having a seizure underwater puts the diver in great jeopardy and also increases the risk to the dive buddy, as that buddy may be called upon to perform a potentially dangerous rescue. If you have any questions about your fitness to dive or how certain medical conditions affect diving fitness, call Dan for more information or for a referral to a diving physician. The remainder of this video will discuss both types of fitness to dive, beginning with diving fitness. Our fitness to dive changes on a daily basis. Lack of sleep, hangovers, colds and fevers, or allergies all influence our ability to dive on a daily basis. Simply having been declared medically fit to dive once, days, weeks, or even years before, does not automatically mean a diver is fit to dive at that particular moment. The heart, lungs, and the ears and sinuses are all involved in diving. Any condition that affects these systems can impair a diver's ability to dive. A true assessment of a diver's ability and fitness to dive needs to consider several questions. Can you successfully equalize all gas-filled cavities, naturally or otherwise? This includes your ears and sinuses, but also air spaces like masks and hoods. Does the diver have any conditions that may cause him to become suddenly incapacitated? This includes neurological and cardiac conditions. Is the diver fit enough to respond to the needs of the dive? This includes handling strong currents, high seas, and long surface swims, and is doubly important if you know before the dive that any of these things is a possibility. Lastly, does the diver have any conditions including age, maturity, psychological, physical strength, swimming skills, or coordination and balance problems that are incompatible with the stress of the planned dive? There are a number of tests and ways to evaluate fitness to dive, or being fit enough to make the dives a diver plans to make. Unfortunately, none of these tests are considered foolproof or exact. When divers are physically fit, they have greater reserves to handle the unexpected physical demands that may appear on dives. Being physically fit won't keep divers out of trouble or prevent medical emergencies in the water, but it definitely compensates for some of these. You need a strong heart that is able to respond to workloads. Low cholesterol means reduced susceptibility to heart disease. There's also some very preliminary data that shows elevated aerobic fitness may reduce bubble formation in animals and humans. Beyond being fit enough to dive in general, you also need to be prepared to dive on the dive day. There are various conditions and situations that influence your ability to dive at any given time. Think of this as completing a checklist to make sure your body is ready for the dive. Do you have any aches and pains, bleeding or wounds, headaches, fever, or other concerns or complaints that would keep you out of the water? Next, go head to toe, thinking about how each area of your body influences the dive. Is your head in the dive? Are you alert, relaxed, and ready with no hangover, dehydration, or fatigue? How are your eyes? Did you remember your corrective lenses, and is your mask fitting correctly? Can you equalize your ears? Hearing and balance normal? Same goes for your nose. Is it open and not congested? No sinus problems or bleeding? How does your mouth feel? No loose teeth or dentures or jaw pain? Does your regulator mouthpiece fit comfortably? Are you limber? Do your neck, arms, legs, and back move correctly with no stiffness? Are you pain-free? No pain, tightness, burning sensation, or congestion in the chest, and is your breathing normal with no coughing or wheezing? And finally, do you have adequate thermal protection for the dive? This will cover your body, head, hands, and feet. Once you've reviewed this head-to-toe check and everything is working the way it's supposed to be, you're ready to gear up and get in the water. There are several major conditions that affect a diver's overall ability to dive. 3 that every diver should be aware of include heart disease, asthma, and diabetes. You'll also find more detailed explanations of each in your student handbook. Heart disease is the most frequently reported chronic health condition in divers who died in dive accidents tracked in DAN research data. In a recent accident report, almost 15% of dive fatalities were associated with high blood pressure and heart disease, and the percentage has remained about the same for several years. According to the American Heart Association, steps to counteract heart disease and stroke include lowering cholesterol, keeping blood pressure low, getting regular exercise of at least 30 minutes most days of the week, and eating a healthy diet with fruits, vegetables, nuts, lean meat, and low-fat dairy items. You should also quit smoking and avoid exposure to secondhand smoke. Another heart issue that concerns divers is high blood pressure. As long as your blood pressure is under control, the biggest concern for diving is possible side effects from medications. Beta blockers can impair your ability to exercise and have been sometimes associated with potentially dangerous fluid buildup in the lungs while diving. You should have regular screenings to watch for long-term consequences of high blood pressure. Another risk to divers that is influenced by body weight and fitness is diabetes. The basic physical exertion of the dive and cold water can bring on wide swings in blood sugar levels. Low blood sugar episodes can put insulin-requiring diabetics at great risk of drowning. A diabetic who is unaware of his condition or unprepared for it could lose consciousness in the water. Generally speaking, divers who are diabetic should only dive when their insulin is well controlled. They should also dive with their blood sugar slightly high to guard against a rapid decrease while underwater, while taking along glucose tubes in case they feel their blood sugar dropping and need to supplement it. Asthma is a lung disorder. The muscle tissue surrounding the breathing tubes contracts excessively, causing narrowing or bronchoconstriction. This causes increased breathing resistance, bringing on the symptoms we all recognize as wheezing, chest tightness, cough, and breathlessness. Exposure to allergens, noxious fumes, cold air, and exercise can all bring on asthmatic episodes. Excessive mucus production brought on by asthma and the narrowing of the bronchi can make it harder for an asthmatic to exhale on ascent. This can potentially cause lung overexpansion injuries and arterial gas embolism. Active, uncontrolled asthmatics should not dive. The same goes for those whose condition is brought on by exercise, cold, emotional stress, or saltwater inhalation. Any asthmatic who does dive should be free of symptoms, and after an attack, a diver should not dive until the airway returns to normal. There are concerns both for the very young and the very old with regards to diving. Unfortunately, there is very little scientific information to say definitively how the body will react or what effects diving will have on the body. The very young are still developing in body size, strength, and stamina. They often lack mental awareness and maturity, which are important in diving. The very old are not generally fit as they once were, losing strength and stamina. Beyond those concerns, age is much less significant, although there has been an association of increasing risk of DCI with increasing age. Health, fitness, and maturity are much more important. For older divers, there is no upper limit based purely on the number of birthdays. If the diver can meet the necessary physical and medical standards, there is no reason why an older diver can't dive. Aside from the other medical conditions discussed earlier, such as heart disease, there is no reason divers can't keep diving well into their retirement. However, it is suggested that older divers add additional conservatism to their decompression. Additionally, keeping fit to dive will help keep the older diver fit for life. The regular exercise and activity of diving itself will keep older divers moving and fit as well, making it a very beneficial cycle. Unfortunately, there is very little scientific information on the safety of diving in children. There is certainly no proof at present that children are at greater risk of getting decompression sickness or suffering a dive accident than adults are. However, there are several other considerations that may affect their safety. Children have a greater body surface area compared to body mass, meaning that they get colder faster. Their lungs are still developing until about age 8, and this introduces certain risks. Given the variable development rates, some argue a minimum age of 10 to enter diving. As far as physical abilities are concerned, children are not as strong as adults. Dive gear is not designed for children, and both the weight and fit of the dive gear may cause problems with comfort and safety. Children also do not have the same physical endurance as adults, and this may affect their performance in survival situations or in adverse diving conditions. However, there is so much individual variability on this issue, it isn't possible to make specific recommendations based on age alone. The biggest concerns with children revolve around their emotional and intellectual maturity. All divers must be able to learn the necessary skills, understand the risks, and act responsibly as a diver and as a dive buddy. Children may not always meet these requirements. In the water, many limitations are removed, lending divers full range of movement and freedom. Divers with disabilities, such as paralysis or blindness, can dive easily and experience the underwater world, along with the travel and cultural opportunities that come with it. However, specialized training, certification, and diving techniques are required. There are many associations and dive clubs dedicated to disabled divers throughout the world. Organizations like the Handicapped Scuba Association and the International Association of Handicapped Divers have underwater educators that are specially trained to help disabled scuba divers in 40 countries worldwide. The most common diving injury and probably least understood body system is the ears and sinuses. As divers, we learn the basics of equalizing our ears, but don't really understand how it all works. As divers, we have to adapt to the pressure changes caused by water as we descend. These changes are much greater than those we encounter while flying or traveling over mountains. With proper basic instruction, most people are able to learn how to balance their ears to pressure when diving, a process we call equalizing. That is what this short video is all about. Equalizing ear pressure, the key to safe, enjoyable diving. Our ability to hear sound depends on the eardrum effectively transmitting sound waves to the inner parts of the ear. The eardrum covers the entrance of a hollow space called the middle ear, where the sound waves are amplified for interpretation by the brain. Pressure changes cause the eardrum to bulge inwards or outwards, which can become painful. To avoid discomfort, you must equalize the pressure in the middle ear with the pressure outside the eardrum. You equalize your ears by gently forcing air into the middle ear airspace through a tube that runs from the back of the throat to the middle ear, called the eustachian tube. It varies in size and shape between people, and its function can be affected by colds and allergies. This is why some people find it easier to equalize than others. You cannot dive safely if you cannot equalize the ears. However, with better understanding and a little practice, most people learn this quickly and without difficulty. When ears are equalized, the eardrum is able to move freely and function properly. This also avoids discomfort or pain due to an overstretching of the eardrum. Your ears should never be painful, either before, during, or after diving. While it is quite common to feel a mild sense of fullness in the ears after a day's diving or pool training, there should not be any deafness or ringing in the ears. After a dive, if you find that sounds are suddenly inside your head when you speak, or you have difficulty hearing properly after diving, you may have experienced a degree of pressure damage to the ear, also called ear squeeze. To see what this feels like, briefly block off one of the openings to the ear canal with your thumb and say a few words out loud. It will seem as if the sound is inside your head. If this happens to you, try equalizing the ear using the techniques we will be teaching you shortly. If you're unable to do so and the blocked feeling lasts for more than a day, seek medical advice. Remember that you must be able to equalize easily to be able to dive safely and enjoyably. Divers must actively equalize their ears, usually every 2 to 3 feet or about once every breath during descent to allow their ears to adapt to the increasing water pressure. As you gain experience diving, your ears will guide you, and you will become attuned to the subtle changes in pressure that prompt you to clear your ears. Okay, let's start equalizing. First, pinch your nose and try swallowing. You should feel and hear a clicking sound or a sense of fullness. It may just feel like something is happening in your ears. That is what equalizing is about. Don't be discouraged if you didn't feel anything yet. You're only just starting. Next, pinch your nose and blow against it. Keep your mouth open slightly. This is called the Valsalva maneuver. You can blow about as hard as you would to inflate a large balloon, but don't do it for longer than about 2 seconds at a time. You should notice a clicking or fullness in the ears. If you still have not felt your ears clear, here are 2 more tricks to try. Try the Valsalva maneuver again. This time, jut your jaw forward. This straightens the eustachian tube and makes it easier to equalize. Some divers find it easier to push the tongue against the roof of your mouth while pinching the nose. The tongue applies pressure that helps the eustachian tube open. Some divers try saying or in the back of the throat at the same time. Most people find that one ear equalizes more slowly than the other. This is quite normal, but may be a nuisance while diving, and if it occurs, will necessitate a slower descent. To make it easier, tilt your head to one side with the slower ear pointing up and stretch your neck muscles. This stretches the back of the throat and the openings of the eustachian tube, making the ear facing upward easier to equalize. Try it, even if your ears were clearing simultaneously, just to experience the effect. The ear facing up equalizes more easily than before. Find the technique that works best for you, but remember, never force your ears to equalize. Once you descend, you will notice pressure increasing on the ear and disappearing when you clear the ears successfully. Any feeling of fullness disappears, and you will be aware of a change in your hearing. Sounds tend to become a little lower when the ear is relaxed, and become more high-pitched when pressure is applied to the eardrum. You'll know when you've cleared your ears by the change in sensation. The feeling of discomfort will go away, or your hearing will return to normal. Or if you've waited a little too long, you might hear a squealing sound as you have to force air through a small opening. If you don't hear a sound, or there isn't any change when you equalize, you have probably waited too long and your eustachian tubes are closed. In this case, the only thing you can do is to ascend a little bit to reduce the pressure blocking the eustachian tube and try again. To make equalizing easier, descend feet first. This puts you in a better position to equalize, and the descent tends to be more controlled and slower. You may want to clear your ears before you duck your head underwater to give you a head start. After your head is underwater, you should equalize every few feet to keep your ears clear. It may help to blow the nose before diving to ensure everything is clear before you get in the water. If you don't equalize your ears, pain will build as your eardrums bend inward. Blood or plasma will be drawn into the middle ear in an attempt to fill the gap. This is what caused the feeling of fullness in the ear after a dive when there have been difficulties equalizing. If you descend so quickly that the eardrum is stretched to its breaking point, the eardrum will puncture. Often there is a temporary relief of pain, followed by dizziness for up to a minute. The ear will not return to normal on ascent. On the surface, you may experience a feeling of fullness and diminished hearing. Within a few hours, pain may start to build up as the water causes inflammation or infection. If you experience this problem or experience fullness or pain in the ear that lasts more than a day, have your ears examined by a medical professional. If that dizziness persists after the dive, you should promptly call Dan for advice. If you have any questions or need to find a doctor with experience in handling dive-related medical problems, call Divers Alert Network, Dan. Dan can provide expert medical advice 24 hours a day to help you with medical emergencies related to diving. Most divers have some trouble with their ears from time to time, but with a little care, patience, and practice, ear equalizing is a cinch and need not keep you out of the water.